Help me study for my registered dietetic technician exam. Here's 10 follow-along practice questions for principal/clinical and food service. Cracks and redness at the corners of the mouth and a painful, smooth, purplish red tongue are characteristics of which vitamin deficiency? A. Niacin. B. Vitamin C. C. Thiamine. D. Riboflavin. The correct answer is D. Riboflavin. These are characteristics of erythrobioflavinosis, a vitamin B12 or riboflavin deficiency. Riboflavin is part of coenzymes flavin mononucleotide and flavin adenine dinucleotide used in energy metabolism and also supports normal vision and skin health. Riboflavin can be naturally found in milk, yogurt, cottage cheese, meat, leafy green veggies, whole grain bread, and enriched cereals. Did you get it right? Let's do another. Treatment for a peptic ulcer may include A. Omitting citrus foods, B. Hydrolyzed protein formula, C. Antibiotics, D. Low residue diet. The correct answer is C. Antibiotics. Peptic ulcers are sores that develop in the lining of the stomach, lower esophagus, or small intestine. They are usually formed as a result of inflammation and infection caused by the bacteria Helicobacter pylori or H. pylori. Peptic ulcer may also be caused by frequent use of anti-inflammatory medications, smoking, consuming too much alcohol, radiation therapy, or stomach cancer. Common antibiotics used to treat peptic ulcers include amoxicillin and other medications hard to pronounce. Patients with peptic ulcers are generally recommended to follow a normal, well-balanced diet rich in vitamin A and C to assist healing. A bland diet is no longer recommended for treatment of a peptic ulcer since some of the foods limited in the diet are essential for healing and helping with symptoms. The recommended diet should contain a variety of vitamin A and C rich fruits and veggies such as carrots, dark leafy greens, broccoli, cauliflower, sweet potatoes, bell peppers, citrus fruits, strawberries, mangoes, and apricots. Other recommendations may include eliminating or limiting milk if the milk offers temporary relief followed by excess acid production and an increase in pain. Attempting foods containing probiotics, especially if taking antibiotics for H. pylori. Limiting or avoiding alcohol, as alcohol can irritate the lining of the stomach and intestines, which can delay healing and lead to inflammation and bleeding. Quitting smoking, as smoking may delay the healing of ulcers. Taking pain relievers with a meal. Keeping a food diary to determine any foods that cause irritation and pain. Did you get it right? Let's do another. Using the exchange list, how many grams of carbohydrates does dried fruit contain per serving? A. 30 grams. B. 15 grams. C. 7 grams. D. 5 grams. The correct answer is B. 15 grams. In the exchange list, the fruits category encompasses all fresh and frozen, dried, and juiced fruit. As a general rule, a serving yields a half a cup of fresh fruit or fruit juice, or a fourth cup of dried fruit. Nutrition per serving in the fruit category: carbohydrates, 15 grams. Fiber, 2 grams per serving of fresh, frozen, and dry fruits. There's very little fiber in fruit juice. Protein, 0 to minimal amounts. And fat, 0 grams. Calories, 60. Examples of one serving of dry fruit may include 4 apple rings, 8 apricot halves, 3 prunes, and 2 tablespoons of raisins. Did you get it right? Let's do another. You are a consultant for a long-term care facility. The kitchen in the facility is very small, yet has to accommodate all the patients. The facility is seeking your advice as to what piece of equipment they should purchase given a small kitchen area and the need to yield a high number of meals. You recommend A, a deep fat fryer, B, a deck oven, C, a microwave oven, D, a steam table. The correct answer is B, a deck oven. A deck oven is ideal for small kitchen spaces since it has multiple compartments for cooking multiple rows of food at one time. Deck ovens use conduction heat as well as radiation heat, which is a process that utilizes infrared heat waves to penetrate the food, heating it throughout. Did you get it right? Let's do another. Which of the following meals contains the most protein? A, 1 cup spaghetti with a half a cup spaghetti sauce, 2 ounces of sausage, and 1 slice of Italian bread. B, 3 ounces chicken breast with a third cup of brown rice and a half a cup of steamed broccoli. C, medium blueberry muffin with 8 ounces low-fat milk and a half a cup of fresh fruit. D, sandwich containing 2 slices of whole grain bread, 2 ounces of deli turkey, 1 ounce American cheese, 1 sliced tomato, 1 leaf of romaine lettuce, and 3 rice cakes. The correct answer is D, the sandwich containing 2 slices of whole grain bread, 2 ounces of deli turkey, 1 ounce of American cheese, 1 sliced tomato, 1 leaf of romaine lettuce, and 3 rice cakes. Using the exchange list, you can determine the approximate amount of protein in each of these meals. Remember, 1 serving of meat and meat substitute yields about 7 grams of protein. Milk is about 8 grams of protein. Starch is about 3 grams of protein. Vegetables have about 2 grams of protein. And fruit in the fat groups will have 0 grams of protein. Now we'll go through the meals listed and calculate the protein in each. Meal A. 1 cup spaghetti is 2 starch servings, which is 6 grams. 1 half cup of spaghetti sauce is 1 vegetable serving and 2 grams. 2 ounces sausage is 2 meat servings and 14 grams. 1 slice of bread is the 1 starch serving and 3 grams. So this meal protein total is 25 grams. Meal B. 3 ounces of chicken breast is 3 meat servings or 21 grams of protein. 1/3 cup of rice is 1 starch serving or 3 grams of protein. 1 half cup of broccoli is 1 vegetable serving or 2 grams. So the protein total for this meal is 26 grams. Meal C. The medium muffin is 2 starch servings or 6 grams. The 1 cup milk is 1 milk serving or 8 grams. 1 half cup fresh fruit is 1 fruit serving or 0 grams. The protein total for this meal is 14 grams. Meal D. 2 slices of bread is 2 starch servings or 6 grams. The 2 ounces deli meat is 2 meat servings or 14 grams. The 1 ounce cheese is 1 meat serving or 7 grams. The tomato and the lettuce don't make up a full serving in the vegetable group, so this will be 0 grams. 2 rice cakes is 1 starch serving. Since there are 3, the protein amount will be slightly higher at 4.5 grams. So the protein total for this meal is 31.5 grams. In summary, the turkey and cheese sandwich with rice cakes contains the most protein of approximately 31.5 grams, and all the other choices are less than 30 grams protein. Did you get it right? Let's do another. In the receiving area, you notice a pepper-like substance all over the floor and smell a strong, oily odor. What do you suspect? A. Cockroaches. B. Spiders. C. Bats. D. Rodents. The correct answer is A. Cockroaches. Cockroaches are nocturnal and are most active at night, which is the time of day they forage for food and mate. They prefer dark areas near food and moisture. When an area becomes too populated, some may be forced out during the daytime, usually in search of food. Cockroaches carry pathogens and are very dangerous to the food service industry. An infestation is not only harmful health-wise, it can also be detrimental to the establishment's revenue, with having to shut down momentarily to exterminate the problem and from losing customer loyalty. Cockroaches make their presence known by leaving a pepper-like substance, cockroach stool, on the floor and a strong oily odor. Glue traps and liquid residue sprays are commonly used for the treatment of cockroaches. Did you get that right? Let's do another. Which of the following individuals is most likely to experience the formation of a bezoar? A. Gastroparesis patient with poor digestion on a high-fiber diet. B. Bulimia nervosa patient following a binge eating episode. C. Patient with esophagitis consuming excessive alcohol and spicy foods. D. Patient with peptic ulcer and being treated with antibiotics. The correct answer is A. Gastroparesis patient with poor digestion on a high-fiber diet. A bezoar is a tightly packed mass of undigested or partially digested material that builds up in the stomach. The materials are often fibers but may also be from undissolved medications. The patient with gastroparesis is the most likely to be the individual out of the choices to develop a bezoar. Gastroparesis is a condition of delayed gastric emptying. The patient has poor digestion, which means he may not be chewing his food adequately. He is following a high-fiber diet, which is often the source of bezoar mass, and he has delayed gastric emptying. Bezoars are treated medically with enzymes or endoscopic therapy to break up the mass. Did you get it right? Let's do another. How much lighting in watts is suggested per square foot in the dry storage area? A. 60 watts. B. 10 to 12 watts. C. 2 to 3 watts. D. 15 watts. The correct answer is C. 2 to 3 watts. Dry food storage areas should be well lit, but the amount of light should be relatively low. Some food items may be affected adversely by direct sunlight, so windows should be frosted or covered to allow minimal light to enter. As a rule of thumb, the dry food storage area should be lit with 2 to 3 watts per square foot. Lighting intensity can also be expressed by foot candles and lumens. For dry storage, the lighting should be approximately 10-foot candles or 108 lux per square foot. Did you get it right? Let's do another. The dinner plates just came out of the dishwashing machine. You notice several dishes that still have suds on them. What could you do to correct this? A. Run a cycle without any dishes present. B. Bring in a maintenance repair personnel to service the equipment. C. Use a treatment to reduce the alkalinity of the water. D. Change the detergent to a low sudsing product. The correct answer is D. Change the detergent to a low sudsing product. Foaming or suds left on dishes as they exit the dishwashing machine can be a result of a high sudsing detergent, suspended detergent solids in the water, or food soil in the machine. If the problem is called as a result of the detergent, you can change the product to a low sudsing detergent or use an appropriate treatment method to reduce the detergent solid content in the water. If the problem is because of food soil, the machine could be cleaned regularly to remove any food particles before washing. Also, the water in the tanks should be changed regularly. Did you get it right? Let's do another. Water that is safe to drink is called A. Clean water. B. Soft water. C. Potable water. D. Main water. The correct answer is C. Potable water. Potable water is water suitable for drinking with low risk of immediate or long-term harm. Potable water should be used as any water that comes in contact with food, such as steamers. Also, water offered as a beverage and the ice which fills an ice bin must be potable.